Hello, I'm Tamara Joffe. I've worked as a GP in the South Kilburn area for the last 20 years or so. South Kilburn, like the rest of Brent, struggled during the pandemic in the first 2 or 3 waves. What became clear was that the uptake in this area was particularly low. We thought through all the reasons why this was and talked to people, and clearly this was to do with issues of trust for a whole range of complicated reasons. With the support of Public Health England and Brent and local council and vials that were given to us of vaccine by the PCN, we set up a community vaccine site here in the heart of the South Kilburn estate, which is surrounded by huge council blocks, many of them awaiting demolition, but still occupied.
I'm Carl Blackburn, I'm the CEO of South Kilburn Trust. We are based in this beautiful old building called the Granville, which has been at the heart of South Kilburn for over 140 years. It has had lots of different lives as an adult education centre, a youth and community centre, a church hall. So it's a place that's known by local people, and it was the ideal place to deliver vaccines to people who desperately needed it and were being overlooked.
With a lot of courage instilled in me by the amazing Sharon Raymond, who set up doing vaccination clinics in green spaces and parking lots, using the London Fire Brigade to set up emergency tents and vaccine taxis in which to vaccinate people in the back. That gave me the feeling that we can just make something happen. And we started to invite people to the first clinics, and slowly word of mouth got round, and people started to tell their neighbours or their family, and more people started to come through, many of whom turned out to be undocumented and not registered with the GP, with no NHS number and no primary care facility at all, or any help at all. Which was a whole revelation to me of this population below the radar of the NHS.
It wasn't a conveyor belt like in some of the large centres. Tamara, Lily and the other volunteers would spend 10, 15, 20 minutes talking to people, reassuring them, giving them information, advice. And quite often they would go away and come back in a week or 2 weeks' time and have their vaccine. It was the perfect community approach to a situation which was new for everybody.
Along the way, we had certain events that just erupted in the middle of the series of vaccine clinics. We ran an interfaith event to celebrate Iftar in the middle of Ramadan, just after Passover and Easter, and it was a really extraordinary evening where the Faiths Forum London got together, 3 imams, 5 priests from 5 different church denominations and 1 rabbi, and together we all had a meal, and it was this wonderful heightened experience, just as hope was coming through that the vaccines were going to be the answer and that there would be light at the end of the tunnel. We also celebrated our 1,000th dose, and it was all a bit like a harvest celebration of the productivity of what each vaccine that we gave, particularly in this population, meant. How people who would not be able to self-isolate, who would not be able to not go to work because they were on 0-hour contracts, who were in jobs that were highly exposed, carers, cleaners, taxi drivers, delivery people, factory workers, needed to be protected. We also linked up with a community centre called Casa de Brazil, a place very much trusted by the mammoth Brazilian community in London, who are almost all undocumented. So we did a Granville vaccinating at the Casa de Brazil, and then for their second jabs, people had enough faith and confidence to come to Granville to get their second jabs, along with the staff from the Casa de Brazil. We're now planning for maybe doing booster shots, and along with it attaching to a general health and well-being forum, sort of drop-in centre for people to come together and make of it what they would like it to be.
I feel it was a resounding success. I think that many positive relationships were also built in that period that are going to continue on in terms of delivering better health services and support to local people. and it's exactly the kind of thing that community venues should be doing.